Good evening and welcome to League of Women Voters Presents. I'm Jim Robertson and our topic tonight is the status of women in Missouri. And this being Women's History Month, it's an appropriate topic tonight especially. Our guests are Elaine Blodgett with the State League of Women Voters and also an active member of the local League of Women Voters chapter. Dr. Kristin Metcalf-Wilson, she's with the Women's Policy Institute. And Holly Burgess is president of the Columbia chapter of the American Association of University Women, and also a member of the Columbia Boone County League of Women Voters. Thanks for being with us tonight, ladies. Kristin, recently a report on the status of women in Missouri was released in October. Tell us about the report and some of the interesting things it found.
Sure. I can give you a little history of what an indicator report is. Perhaps that would be interesting for your viewers that might not understand how these things work. Indicator reports gather established data or existing data from resources around the state or the nation. And what we like to do as the Women's Policy Alliance is pose questions or try to answer questions for the community. So when you look at the existing data that you have, you try to say, well, what does this mean? A perfect example would be free and reduced lunch. It's a statistic kept around the nation. It's recognized for the level of poverty for children and their families. So by looking at a specific indicator like that and then looking at it year after year or 3 years and 5 years, then we can take or have a better understanding for what policies or actions help improve or help make that situation worse for that child. So that is what the Women's Policy Alliance set out to do with our Missouri Women's Report, is look at specific indicators down to a county level so that we would be able to look at our state as a whole and decide what areas of the state it is better for women and what areas of the state they might have more struggles or barriers in their lives. So we looked at, we had focus groups all around the state and an advisory committee to help us decide what's important and relevant. And the 4 categories came out as health, access, and well-being, workforce and education, economic justice or poverty issues, and then civic engagement or political participation. And so we gathered data, most from the mid to 2010, wherever we could get it, down to the county level, wherever we could get it, and tried to compile that information so it gives you a real picture or snapshot with what might be occurring in the state today for women.
Now, when was the last time a study like this was done?
Well, the original Institute for Women's Policy Research out of DC, which is a think tank located in DC, did one for each state in 2000 and 2002. It took them a couple of years to make sure each state got done. So ours came out in 2002, I believe, and sadly, Missouri got a C in its overall rank and a grade for the state. And there were some areas that we did well in, and some areas that we were worse than a C. And so based on that report, it actually was what began the Women's Policy Alliance.
I see.
Yes, that compelled a group of women to say, we can't let this report sit on people's desks and not hear the stories behind the numbers for the women in
Were you
Missouri.
able to measure progress from the 2002 report?
You know, it's interesting because the original report only looks at our state and compares it to other states. So this is actually the original of its kind because we go all the way down to county level data. And the original report just looked at our state in our region and how we compared to other states in our area. So there are some things that I think we were doing well at and we still do well at. Some of the political participation we did well. Have a women's caucus. Some states don't have that. We have a higher voting percentage for women in the state. We have a large number of women participating at local and community levels in elected positions. So we do some things very well. There are a lot of healthcare issues where I'm not sure we've improved, and I think we've probably gotten worse. So.
Well, Holly Burgess and Elaine Blodgett, I know you're both familiar with the report. What kinds of things, what did you find interesting about the report of the status of women?
Well, you know, AAW was very interested in this report because our whole focus is on the betterment of women as far as education, as far as health, as far as in the workplace. So all of the things that were in here, we took a very close look at. Unfortunately, there was nothing that surprised me in the report. It was pretty straightforward. But it was one of the things that was nice, again, was the fact that women are voting. Women are participating. What we have to do is get women to start actually becoming leaders. And I thought one of the things that was interesting in your report was that you recommended that women be more engaged in commissions and committees and that sort of thing, because statistics show that if women will start there and they get comfortable, then they're more likely to then run for political office.
And the report did find that women were participating at that non-paid elected positions. So your PTAs, your school boards. So these they're elected positions, but they're volunteer. We have fewer women actually running for paid office.
I believe I remember that maybe 15 of 300 and some county commissioners in the state, in the entire state, are women.
Yeah.
So that's an indicator of what you're saying.
It's an indicator right there, and so I would compel people to look, because you can look at your county and see how well you're doing, and the website that we have actually is more interactive, because then people can click on 2 or more counties and compare specific indicators such as that, and say, or teen pregnancy or high school graduation. Click on the information you want, click your surrounding counties, and compare yourself, which in a time of limited resources, you need to be able to justify why you might need added financial resource for particular topics rather than another county.
Right.
So it can be very useful for policymakers and advocacy groups, yeah.
Elaine, what stood out for you?
Well, I kind of jumped all over the place. I did look at civic engagement, but what I noticed was, I don't know if you can tell from here, but this book is an easy book to go through and look at the maps, look at everything that's on here and the way the data is presented. So that was the first thing that impressed me. It didn't have a lot of words, and it had a lot of data shown in different ways. Then certain things that jumped out at me were that when women voted, when the percentage of women voting is a little higher than men, when it actually comes to registering and to voting. And then the statement in there was that affects our state policy. And I thought, wow, now that's something we don't think about, that the people who are voting, the majority who are voting, are affecting our state policy, our local policy, and that becomes very critical.
Yeah, and we hope, and evidence shows us that historically, if you have more women participating in policy making or civic engagement in policy, you are more likely to break down some of those barriers that women have found, because the policy then, they look at how it's going to impact them and their families. They say, okay, well, what's in it for me? If I look at this policy, is it going to help other women that look like me, have families like me? Is it going to help? And so you tend to see some of those barriers alleviated in some way or improved if women are participating in the process.
There were statistics, though, that I noticed that jumped out about other women's issues, that I was still surprised that we were having some of what I would call the same problems. The poverty and number of children that young women have, 3 or more before the age of 20. Those kinds of statistics. What can you talk about with that?
Well, one of the interesting, as a healthcare professional, I was very intrigued in looking at the population I serve, because I am a women's healthcare provider, but looking at the number of women living in poverty and their health outcomes, I think is a critical issue for this report. And the maps are so clear. It's staggering when you can look at specific areas, not just a county, but pockets of areas in the state where we need to improve health outcomes. One of the statistics that we did mention earlier, just about poverty, was that it's been understood that we have a lot of children living in poverty, and that's because a family might have 2 or 3 or 4 kids, so you count all 4 kids, right? So, but if you look at individuals and you try to get a gender disparity, the largest actually gender despairing group is women over the age of 65 in our county, so in our state. So it's actually at 38%, women 65 and older live in
live
poverty.
in poverty.
Yes, and that struck me and is a very aha moment for some people to think 38%, while men are 35 and 34%. So, you know, if there's a big disparity like that in a specific age group, we need to take notice. And that age group is the growing population because those are our baby boomers.
Sure.
And I'm not sure our state's prepared.
Is there a
for that.
geographic distribution that's significant for those?
There is. Women living in poverty are more likely to live in the Cape area or in the southeast area of the state. We have more women that live in poverty in that specific area, but we also have poorer health outcomes for that area as well. So as we had talked about before the program even, I think these are such complex issues. One thing doesn't, touches the other. So poverty touches the healthcare issue. Workforce education touches the poverty issue. So we can't look at them in single. We have to look at them as a whole. And that the southeast area has poor health outcomes. Yet, if you look at our insured population, public and private insured population, there are more insured people, insured women, living in that area of the state. So they have healthcare insurance. So if that's not the issue, what is the issue? Is it education about their own well-being and how to care for themselves during a pregnancy or with diabetes? Is it access to providers? Is there a good number of providers down there that provide prenatal care? Though transportation, all of those things interact with each other. So we can't try to fix one and not think about the others.
That's what struck me when I read through this report is they're all interconnected. I mean, you can hardly separate income, education, healthcare in analyzing the status of women. It's one thing affects the other, is what you just said.
Well, and it's true because as you were talking about the graphics, I mean, just in this graphic alone is infant mortality rate. And so the darker the county, the higher the rate.
Which one is that?
This is over here,
Right, this, yeah.
right at this side. And so, you know, when you look at the darker areas, it's not just a county by itself. They group themselves. And we also know that there are more women with insurance provided by the state, even Medicaid covers pregnancy, that live here, but yet they have the highest infant mortality rates. So it is complex. Everything touches each other, I think.
What about the distribution between rural and urban?
Well, we did find that there are pockets of, when we look at health and education together, we do have urban areas around the St. Louis area that are higher infant mortality rates, poor diabetic control, and the Cape area as well. And you also see a higher percent of non-high school graduates, so people that don't complete high school. And so education is a big issue as well.
Was that 17%? I remember 17% of women do not have a high school degree?
Yes.
That's an amazing figure in today's world.
But you did mention that also includes the population of plain people. I mean, women in groups that aren't expected, like the Amish, the Mennonites.
There's a large Mennonite community, and so there are county levels that have suppressed data in here, and we represent those in white and let you know that there's not available data. And that would be a non-traditional community like that doesn't provide a formal education, so there's not a way to measure a high school diploma. And so that county wouldn't be represented. It would be a skewed number, yeah.
Or, you know, young women who have become pregnant, who drop out of high school. Until recently, I can remember when you became pregnant, you just left. You know, luckily in the Columbia public school system, there are alternatives. But sometimes those alternatives don't work either because the dynamics of the family are unhealthy. And so it's not easy to continue with their education and be pregnant anyway.
And, you know, and it's interesting when you look at that high school education or teenage pregnancy, because a lot of those things intertwine with each other. But if you have a young mother that hasn't completed high school, even if she's above a teenager, if you have a young mother that hasn't completed high school, she's more likely to live in chronic poverty for long periods of time and use public assistance programs. So if you look at, even if we just use Medicaid in adults, it's the numbers in 76% are adult women. So if you look at just the adults on Medicaid, 76% are women. So it is despairingly used. I mean, more women use that program than men. So if in policy you decide to change that program, you will
affecting
make
more women.
you affect more women and their families because they rely on those programs for a longer period of time.
You know, something else I'm curious about when you're talking about programs for women is there seems to be this backlash now on contraception, you know, reproductive health. Is that the idea is that that I'm not sure exactly what's going on where all of a sudden it's not okay to decide when you want to have a child.
Right, and in fact, one of the numbers that we looked at here by county was unintended pregnancy, and we talked about this earlier, Holly, that unintended pregnancy isn't just an adolescent issue. In fact, the Alan Guttmacher Institute did a survey last year and said 4 out of 5 women during this economic recession would choose not to have a child at that time. So it's not just about an adolescent not getting pregnant or having sex or not having sex. It's about women's abilities to participate in the workforce, to continue their education as they want to, and to plan that pregnancy so that they can care for their families, and to know when they've had enough. So the access to contraception and reproductive health is a critical issue, and it's clear there are areas around the county where unintended births are a significant public health problem.
Do you think that access is the problem there?
Well, we do know that there, since 2000, the family planning program here in the state was cut. So there is less family planning clinics provided by the state. There are family planning opportunities. If you find a provider, Title X clinics or family planning clinics, and you can find those, but I don't think women have as much access in their local health department as they used to. And every county's got one, right? But if they are no longer subsidizing or providing those types of clinics, then transportation becomes an issue. Yeah, I have patients that will drive to see me from Kirksville.
It's a long way.
Yeah, that's a
That's
long
a
way.
long way.
Yeah.
Did you give this to the legislators, or have you had any feedback yet?
Yeah, we had
From
2 weeks ago today. We went and hand delivered a copy to every legislator and their legislative assistant, and we had a press conference last Wednesday in the rotunda of the Capitol, where we had several experts on each area present their findings, what they thought were most compelling, and we are getting very positive feedback. It's a bipartisan report. The feedback has been bipartisan, just statistics that they just didn't know. In fact, there's an equity bill that's being discussed right now in the legislature, and so to be able to say, it might have been your gut feeling that women made more than less, we can show you.
It's actually,
we can show you.
the bill is for an equity commission.
Commission, that's
which
right.
is, I mean, there's no finances involved. It's all volunteer. So it did go out of the committee.
The committee hearing.
But of course, the AEW would love to see that continue.
And it's a start. It's a start.
Well, and it does tell us what we need to know, because we want to know the good news as well as the bad news. We actually want all to be good news so that we can start dealing with other things like scholarships for women to go to school and training and things like that.
That's a positive thing we have in this report. Did you see that?
I did.
Missouri does send more women to college than men.
Yeah,
Good
I was
or bad.
interested in that.
some counties, it's a 4-to-1 ratio. More women attending college.
Now, do I remember right that also women graduate from high school in greater number than men?
They do. They have a higher graduation rate. And dropout rates are really hard too. One thing we did find when you do a report like this is some things that we need to keep better statistics on. Yeah. And that's a hard one because especially in rural areas, our schools are done by district. And so, you might have more than one county represented in a school district. And so then to do a county level report, it's hard they don't necessarily tease out this information so we know the child that dropped out was male or female, lived in this county. We just get a general from this district. So that's a harder statistic, but those are the kinds of questions we need to ask then when you can see, okay, well, this is an area we need more information on, and we need to keep better track of it. Yeah.
Right. Well, let's drill down for a minute on Boone County. What do the indicators tell us about Boone County?
Well, we do have a high graduation rate here. And I would have to look up all my statistics because I don't keep them in my head. But we do have a very good high school graduation rate here. we actually have fewer numbers of unintended pregnancy, although it's still high, but you have below the state average, which is 39%, and I believe Boone County is in the 25 to 34%. So it is lower than the state average. Boone County is, which is a good thing because that means that women are getting more access to the care that they need to help delay those pregnancies. They are attending school, getting involved in the workforce. So we see some positive things. Could we do better? Yeah, we could. We could do better in some, I want to say you looked at the voter information, but did you look specifically at Boone County for that?
I looked a little bit, although
I mean,
it seems to me like we're pretty good.
We are, and in our number-wise, we participate.
Right.
Women.
Right.
And Lynn, wouldn't you say we have, probably in Boone County, we are somewhat well represented by women actually running
Yes.
for office? You know, you've studied that more than I have, but
We do.
We do.
And
we have
yeah,
our county
and if you
commissioner.
just look at our numbers
that's a woman.
now,
Yeah.
we have a county commissioner, we have a female. We have a female in the House of Representatives that's in our area and is now running for Senate. So we also have a female candidate from Boone County that's running for lieutenant governor. So we have women that are not afraid to participate and are very vocal about that. But a lot of that is our access to the education that we have here. Even as a mom, I am so impressed with the education my kids get in Columbia Public Schools because the teachers are so well educated because they have access to continue that education. So, and we have a lot of access to math and science technology for girls here that is not well distributed around the whole state. So girls don't get as much access to maybe some non-traditional jobs in the workforce. When you look at workforce and education, while we send more women to school, we still send them on to more traditional roles, education, nursing. Not that those are bad jobs, but we don't see, hey, I know, but not that those are bad jobs, but we want to see women getting access to science and math and technology education, and we don't see that all around the state.
Right.
Yeah.
You mentioned that you took this report to the legislature, had a press conference. Are you distributing it to counties? There are 114 counties.
Yeah, we have a distribution list, and since we went to every legislator and legislative assistant, we have women's organizations that we are distributing them to. League of Women Voters has a box full. There's some more in my car if you need it. And so we had another press conference in St. Louis, and our funders will get some delivered back to them to help give to their membership. The idea that the report is accessible to everyone was really important to the Women's Policy Alliance. And so making sure that not only were we hand delivering copies, but that the website was user friendly. And people can click on that, get a copy of the report themselves, and look at their own county and compare. Yeah.
I wish we had a graphic of the website, but what is the website? The URL?
Well, it's actually pretty easy to remember. It's MissouriWomen'sReport.org. So just spelled out.
So, and if you wanted a hard copy of the report,
right, you can link there to the Women's Policy Alliance and contribute to future reports or to have one mailed to you, all on the Women's Policy Alliance. You can link from there. So.
Can I make a plug for that?
Absolutely.
Actually, I mean, Elaine and I both agree, it's a fabulous report. It's time to start a new one.
Right, before you know it
and this is not an inexpensive report to put out. And I think it's wonderful that the fact that the groups that are involved in this wanted to make sure anybody had a chance to see it. So if somebody sees this report and would like to make a donation, because I've had a number of people say, well, you have too. How much is it? I want to buy one.
Right.
Well, they're not for sale, but if anybody would like to make a donation towards this, then they can do it through, again, www.
Have you
Missouri Women's Report.
Have you distributed them to the libraries? Because this would be a great report to have in the library.
On file, yes, and that's part of our distribution list is that we have a list of all the libraries. So.
And I'm sure
and
legal be asked to help with that.
Asked to help with that, yes. But it's a very exciting opportunity to be able to talk about it, to get people to talk about women's issues again. I mean, we've got elections coming up. Right. It's important to be armed with the information so you could ask a potential legislator or policymaker, what do you think about this? What can we do to improve it? And then get them on record when they say it, right?
and as you said, women vote in greater numbers than men, so that they have power.
They do.
And these issues are issues that they should be concerned about,
Right.
interested in.
You know, and as I just philosophically, these kind of things just make sense to me now, having studied it for so long. And like you said, it's almost time for another report to start, because this was a 3-year project for me. But it's also important to know what it means to the women out there, because we have more single head of households that are women raising children on their own, taking care of their parents. And so those numbers are significant. And if we don't recognize the barriers they have, then we're really hurting all of our communities.
One of the things that I found hopeful about this is the fact that the generation of the 19 to 29-year-olds is almost as large as the baby boomer generation.
Yeah.
And that's a generation of people who are hopeful, who are responsive. I mean, they're our future. And I think that we're going to find, you know, that they are community-oriented.
And have unparalleled access to information.
Exactly.
Yes, as never
yeah.
before.
Right.
Yes, and they're going to school and delaying marriage. Just in our statistics, you can tell that women are waiting longer to get married. They're more likely to go. Women are more likely to attend college than men. So there are some hopeful things in the report as well that I think we need to recognize and say we're doing this well.
Yep.
Yeah.
Any closing thoughts from the three of you?
Oh, I'm just thinking about follow-through. Is there any idea about what kind of follow-through counties can do, or
we
groups can do?
have policy recommendations in the report. So after we looked at each sections, the Women's Policy Alliance and their board and the research team sat down and said, you know, what are some compelling issues that we need to attack first? And so we do have policy recommendations there. The Women's Policy Alliance is not an advocacy group, so we're not going to go out there and say, pass this law, don't pass this law. Well, we are keeping track as a think tank what helps and what hurts, and hopefully by educating those advocacy groups and policymakers, we take steps in the right direction. But we do have recommendations in here for specific issues, yeah.
Well, hopefully you can update us in 2 or 3 years and see if we're making progress or not.
Look forward to it, yeah.
So and anybody who's interested in this issue, and everyone should be interested in this issue, get a copy of this. It's at MissouriWomen'sReport.org, and it's just full of great information that will be an eye-opener. Thank you all for being part of the program this evening. Happy Women's History Month.
Well, thank
Thank
you.
you. Thank you for having me.
And thank you, viewers, for tuning in. We'll see you next month. I'm Jim Robertson. Good night.